So at Destination Hope, we provide all levels of care for substance abuse and mental health treatment, starting with detox for clients struggling with substance use. If you've been using substances for an extended period of time, you're going to need to go through a medical detox protocol so you can safely come off of whatever substances you've been using, and that's where your treatment would start. Once you're medically stable, then you would enter into residential treatment. Residential is the next level of care for both substance abuse and mental health. That's where you would really start working on your treatment plans, meeting with the psychiatrist and your therapist, attending group. Where the most intensive real work begins would be in residential. Once you complete residential treatment, you would step down to our partial hospitalization program, still engaging with therapeutic and psychiatric services at a very intense level, but with the ability to have the kind of freedom to test yourself and your skills that you've learned at residential, to be able to take better care of yourself, to make progress in the recovery process, attending outside meetings, getting a sponsor, working more on, managing triggers, coping skills for your mental health symptoms. Once you complete PHP treatment, you would step down to our intensive outpatient IOP program, where you transition into an environment where you have even more freedom. You're attending groups 3 nights a week, individual therapy once a week, and then living on your own in our transitional living that we have, or in other transitional living in the community, where you really start to engage in the community environment, get a job, go back to school, perhaps live with your family, while still receiving the intensive services with the therapist and a psychiatric team. Keep up with your medications, continue engaging in your program with your sponsor, and then eventually stepping down to outpatient, which would really just be 1 to 2 times a week, continuing with psychiatric services, keeping up with medication follow-ups, and really re-engaging with normal life, being with your family, going to school, working, and continuing to have support, but not the intensive support that you received at the other levels of care. The most special thing about Destination Hope is our ability to be flexible. There are times when clients might really struggle or have an experience that sets them back, and our ability to move people up, perhaps from IOP to PHP, from IOP to detox or residential if there's a relapse, and then not miss a beat. Continue working on the progress that you've made and working on, the things that you still struggle with.